Hello, I'm Dr. Margaret Ellis, and today I want to talk to you about a topic that many older adults tend to overlook: persistent itching. What most people dismiss as dry skin, allergies, or the natural effects of aging can sometimes be an early warning sign of a more serious underlying condition. In my years of experience as a physician, I've seen firsthand how subtle symptoms like localized itching can reveal issues that need immediate attention. In this video, I will guide you through 6 specific areas of the body where itching should never be ignored. I'll explain what to look for, why it happens, and simple ways to pay attention to your body so that you can catch potential health problems early. By understanding these warning signs, you can take control of your health and protect yourself before minor discomfort turns into something more serious. Stay with me, because what you learn today could help you, or someone you love, detect a problem early and potentially save a life. Itching, a symptom so common that most people associate it with dryness, allergies, or aging, can actually be much more than just a simple skin issue. My grandfather used to say that the body is a persistent messenger, and that localized itching, when it persists and doesn't respond to basic treatments, may be revealing something deeper. I've seen this in my clinical practice, and I also learned it from listening to his stories. I remember one consultation that marked me in a special way. A 76-year-old man, whom I'll call Oliver, came in saying that every night, right after bathing, he felt an intense itch on the lower part of his legs. He had tried moisturizers, homemade ointments, even hot compresses, and nothing worked. The most curious part was the time. Around 3 a.m., the itching became unbearable. His worried wife had accompanied him, looking for an answer. When I examined his skin, there were no clear lesions, nothing that justified that discomfort. That's when I remembered what my grandfather had taught me, and I decided to order deeper tests. The result was shocking: an early-stage lymphoma. Oliver looked at me with tired eyes and said, "I thought it was just because I was getting old." That phrase made me reflect. How many older people carry symptoms without giving them importance, convinced that everything is due to age? Yet science shows us otherwise. An analysis of more than 50 years of medical records revealed something that matches what many oncologists have observed. A significant percentage of cancer patients had experienced persistent itching months before diagnosis. This is no coincidence. That's why today I want to talk to you about 6 specific areas of the body where itching can be an early warning sign of different types of cancer. And not only that, I'll also share with you 5 simple self-check steps you can do at home to distinguish common itching from itching that deserves medical evaluation. This information is vital, especially if you're over 60 or caring for an older loved one. It could mean the difference between detecting cancer early or facing it too late. I invite you to stay with me until the end, because what I'm about to tell you may help you or someone you love. This is not about living in fear. It's about living with awareness, learning to listen to the signals your body sends you. Like my grandfather, I believe medicine is not only in prescriptions and hospitals, but in the ability to observe and act in time. Today, together, we're going to learn not to ignore those signs that could save lives. Risk zone number 1, the cough. I want you to pay close attention here, because this is one of the areas where a simple skin problem is most easily confused with something much more serious. When an older person feels constant itching on the front of the legs, especially at night or in the early morning, we must suspect something deeper than dryness. What we often see in the clinic is that the person first thinks it's a circulation issue, poor hygiene, or just common dryness. I remember a patient I treated not long ago, Tommy, 75 years old. For 3 months, he endured an itch on the lower part of his legs that woke him at 3 a.m. every night. At first, he didn't think much of it. He applied moisturizing creams several times a day. When that didn't work, he tried hot massages, compression stockings, even expensive lotions his wife bought, hoping to relieve him. But nothing helped. The itch kept growing, leaving him exhausted. When I examined him, there were no obvious lesions on the skin, no redness, no eczema, no rashes. The striking detail was that the itching worsened when he lay down, exactly when he should have been resting. During the day, with activity, it seemed to improve, but at night it returned strongly. That detail, which may seem minor, set off my alarm. Lymphoma, a type of cancer that affects the lymphatic system, often manifests with precisely this kind of nighttime itching that doesn't respond to standard treatments. The lymphatic system, responsible for filtering and mobilizing our defenses, when inflamed, releases substances that stimulate the peripheral nerves. That stimulation generates the sensation of itching without visible skin lesions. It's an internal mechanism, a silent warning that something is wrong. To differentiate at home between normal itching and one that deserves attention, I recommend a simple test. Use a moisturizer or a proper anti-itch lotion for at least 1 week, applying it 2 to 3 times a day. In common skin problems like dryness or dermatitis, relief comes quickly. But if after 7 days the itching persists or even worsens, don't ignore it. That's a sign the origin is not the skin, but the immune system. In that case, the wisest step is to consult an oncologist or hematologist. Tommy agreed to undergo blood tests and imaging studies. The diagnosis, early-stage lymphoma. The good news is that, detected early, this type of cancer has cure rates close to 90%. Today, after proper treatment, he leads a normal life and is grateful he didn't overlook that symptom. I want you to remember this. If you feel persistent itching in the lower part of your legs, especially at night, and creams don't help, don't just attribute it to age. The body is trying to say something. Listening to that message could save your life. Risk zone number 2, the middle of the back. Many times when an older person feels itching in a fixed point of the back, they immediately think it's a muscular issue, posture, or the bedding. However, that's not always the case. There's a very particular connection between the pancreas and the nerves of the back. When the pancreas begins to get sick, one of the first warnings may be persistent itching right in that central area. Physiology explains it clearly. The pancreas is located deep in the abdomen and has nerve connections that project toward the back. When the organ starts having problems, whether due to inflammation or a developing tumor, those signals are transmitted to the back in the form of discomfort, diffuse pain, or in many cases, localized itching. What's curious is that the skin in that area is usually completely normal. No lesions, no redness, no marks. Yet the sensation of itching feels as if it's being irritated from the inside. I remember Thea, a 68-year-old woman who came to my office desperate. She had tried everything. First, she changed her mattress, thinking it was a support issue. Then she replaced the pillows and blankets and even did a deep cleaning at home to get rid of dust mites. Nothing changed. The itching remained exactly in the same spot on her back. She tried creams and ointments prescribed by a dermatologist, home remedies, and nothing worked. Every evening, after dinner, the itch would start as if a switch had been turned on. That detail was decisive. When a symptom appears repeatedly in connection with eating, we must think of a digestive organ, in this case, the pancreas. After meals, especially heavy or fatty ones, the discomfort in her back would intensify. It was her body's way of asking for attention. For those who feel something similar at home, there's a simple self-check method. With your fingertips, gently press on the itchy spot. If what you feel is not just itching, but also a kind of heaviness or internal discomfort, that's a warning that should not be ignored. Also, pay attention to your digestion. If after eating fatty foods you notice heartburn, bloating, or irregular bowel movements along with the back itch, it's time to see a doctor. In Thea's case, after conducting deeper tests, we discovered it was early-stage pancreatic cancer. Thanks to her not settling for superficial explanations, she was able to receive timely treatment. Most people would have continued thinking it was a muscular issue or a mattress problem, losing valuable time. I want to leave you with a clear warning. If your skin looks normal, but you have a fixed spot in the middle of your back that itches every day, and that discomfort worsens after eating, do not ignore it. It could be your pancreas trying to communicate that something is wrong. Early detection can make the difference between a long, quality life and a disease discovered too late. Risk zone number 3, the scalp. Most people think scalp itching is due to shampoo, dandruff, or dryness. However, when we talk about itching in very specific areas, like behind the ears or at the lower neck, without flaking or redness, we must think of something more serious. One of the first signs of leukemia can appear in this way. Leukemia is a type of blood cancer characterized by an overproduction of white blood cells. As these cells accumulate, they release tiny inflammatory substances that stimulate the most sensitive nerves in the scalp. Remarkably, externally there are no clear signs, no crusts, lesions, or dandruff, just a persistent urge to scratch that doesn't go away. One of the cases I remember most is Malcolm, a 73-year-old man very disciplined with his health. He told me he had kept a diary for 3 months recording each episode of itching. At first, he thought it was a problem with his shampoo, so he bought a gentler one. When he saw no results, he stopped using conditioner. Later, he tried a neutral soap bar and even decided to wash his hair every other day to avoid irritation. Nothing worked. The strangest part was that there was no dandruff or redness, but the sensation behind the ears and on the neck drove him crazy, especially at night. That nighttime pattern is very characteristic. During the day, with movement and active circulation, the itch eases. But at night, when blood circulates differently, inflammatory substances concentrate, and the discomfort intensifies. It's as if the symptom waits for the moment of rest to make itself known. There's a simple way to check it at home. Place your hand gently over the itchy spot on your scalp. If you feel it slightly warmer than the rest of your head, that indicates an internal inflammatory response. It's not an absolute test, but it is an indicator that deserves medical attention. Additionally, itching associated with leukemia rarely comes alone. It is often accompanied by constant fatigue, small wounds that take too long to heal, easy bruising, or bleeding gums when brushing. These signs, combined with nighttime itching in specific scalp areas, form a clinical picture that should not be ignored. Malcolm eventually agreed to blood tests, and that's when we confirmed the suspicion. Thanks to his discipline in recording everything, leukemia was detected at an early stage, giving him a huge advantage in treatment. Risk zone number 4, the chest. This is a very delicate topic because most people think breast cancer always shows up as a palpable lump. However, there is a type called inflammatory breast cancer, which can begin with something as seemingly harmless as persistent itching on one side of the chest, around the nipple, or under the breast. This signal, which many confuse with irritation from clothing, may be the first warning of an aggressive disease. What characterizes this type of cancer is that the skin starts to change in a very particular way. It may become red, thickened, lose elasticity, and develop a texture that doctors call orange peel skin. Sometimes there is no lump at all, making it even more deceptive. The person scratches, thinking it's an allergy to the bra or a new detergent, but the discomfort doesn't go away. I remember Margot, a 69-year-old patient. She came to my office after several months of struggling with itching in her right breast. She told me she had tried everything. First, she switched to a cotton bra, then to silk fabrics, even tried bamboo, and even went weeks without wearing a bra to rule out friction. But the discomfort remained in the exact same spot. The curious thing was that her left breast was completely normal. It was that asymmetry that made me suspicious. When I examined her, I noticed redness and slight swelling near the nipple. The texture of the skin was different, with a rough appearance not common in simple irritations. I requested further tests, and the diagnosis was clear. Early-stage inflammatory breast cancer. This type of cancer has a dangerous characteristic. It progresses rapidly. Unlike other breast tumors, it doesn't always form a palpable mass, which is why many women are diagnosed late. The good news is that if detected early, effective treatment options still exist. I want to emphasize something important. Men can also get breast cancer. Although it accounts for only about 1% of all cases, in men over 60, the risk exists. And precisely because they do not expect it, they often see a doctor when it is already too late. If a man notices persistent itching around the nipples or changes in color or skin texture on the chest, he should have it checked immediately. So, for both women and men, the rule is the same. If only one side of the chest has persistent itching, redness, or changes in skin texture, do not ignore it. It could be inflammatory breast cancer, which, though aggressive, can be managed if detected early. The key is to listen to your body and act without delay. Risk zone number 5, the anus and reproductive organs. This topic is often difficult to discuss because many people feel embarrassed to report symptoms in this area. However, it is essential because persistent itching in this zone can be much more than simple inflammation or hemorrhoids. When the discomfort is constant, intensifies at night, and feels like tiny needles in a very specific spot, we must pay close attention. In my practice, I treated John, a 76-year-old man with a long history of hemorrhoids he had endured for more than 3 decades. He was convinced that this new itching was just another flare-up, something he was familiar with. He used ointments, traditional sitz baths, and even underwent surgery for hemorrhoids, but the discomfort didn't go away. What was different this time was that the itching was not only during bowel movements or when sitting, it followed him even at rest during the night. That persistence was the key. Hemorrhoids usually cause variable pain or discomfort, but in this case, the itch was constant, fixed in a precise spot, as if something inside was irritating it. Neither traditional treatments nor surgery brought relief. It was then that we decided to conduct further studies and found that the problem was not a hemorrhoid flare-up, but early-stage cancer. The accompanying signs were also revealing. John began to notice small bleeds during bowel movements, changes in stool consistency, and a diffuse discomfort when urinating. These additional symptoms are a clear warning that it is not a common benign problem. In women, it may also present as abnormal discharge, changes in odor or color. All these details, combined with persistent itching, should raise red flags. It's understandable that many older people avoid consulting due to embarrassment, but that delay can be very costly. Cancer in this region, if detected early, has better treatment options and a more favorable prognosis. Conversely, postponing a medical visit allows the disease to progress without offering more opportunities. I want to leave you with a clear message. If anal itching does not improve with conventional treatments, remains in a fixed spot, and worsens at night, do not ignore it, and don't let embarrassment be an obstacle. Speaking with a specialist in time can make the difference between early detection and a much more difficult battle. Remember, your health is more important than any temporary discomfort. Risk zone number 6, hands and feet. This may be one of the most underestimated symptoms because we usually associate itching in these areas with skin problems, soap allergies, or dryness. However, when the itching is concentrated only on the palms or soles and appears more intensely at night, it may reveal a much more serious internal disorder. In my practice, I treated Ray, a 70-year-old man. He came convinced he had a common eczema. Only his palms itched, which made him think it was a household problem, as he humorously described, having spent much of his life washing dishes. He tried moisturizing creams several times a day, switched to mild soaps, and even began wearing cotton gloves at night to protect his skin. However, nothing worked. The discomfort remained exactly the same, no matter what he did. When I examined him in detail, I noticed something easily overlooked: the tone of his skin. His palms had a slight yellowish tint, and the lines appeared deeper than usual. There were no rashes or cracks, just an unbearable itch that woke him at midnight. This detail was key, because itching caused by internal disorders is usually accompanied by very subtle skin changes, unrelated to dryness or allergies. The scientific explanation is clear. Some types of cancer produce toxins that travel through the blood and stimulate peripheral nerves in the extremities. This stimulation results in localized itching, especially on the fingers, palms, and soles. That's why the symptom often worsens at night when circulation changes with rest. The great risk is confusion. Many older adults think this type of itching is due to diabetes, poor circulation, or common dermatitis. Even some general practitioners may attribute it to benign causes and prescribe topical treatments that solve nothing. This false sense of security can delay crucial diagnoses. In Ray's case, tests confirmed that the itching was related to an internal process that needed urgent attention. The fact that it did not respond to creams or basic care was the clearest clue that it was not a superficial problem. That is why, if you are over 60 and notice persistent itching in your hands or feet, especially at night, and if the skin shows a yellowish tone or the lines appear more pronounced, consult a doctor without delay. Although often caused by benign conditions, when the discomfort resists usual treatments, it is better to rule out cancer in its early stages. Paying attention to this signal can make the difference between peace of mind and a disease that progresses silently. So far, we have looked at 6 areas of the body where itching can be a warning sign. However, doubts often remain. How can we know if the itch we feel is temporary or truly warrants a medical evaluation? To answer this question, I want to share 5 simple self-assessment steps that anyone can do at home. These steps do not replace consultation with a specialist, but they provide a clear guide to identify when it is not just a common skin problem. Step 1. The 3-week test. Most allergies or skin irritations improve on their own within a few days. If you apply a basic treatment and notice improvement after 1 or 2 weeks, it is probably a benign cause. But if the itching lasts more than 3 weeks, do not take it lightly. That persistence is the first sign that the origin may be internal, not superficial. Mark a calendar, record the date the discomfort started, and see if it crosses the 3-week mark. Step 2. The lotion test. Use a moisturizer or anti-itch ointment 2 or 3 times a day for at least 7 days. If the problem is in the skin, improvement should occur quickly. However, if the itching does not change or even worsens despite topical treatment, this indicates it is not a skin issue. In that case, internal processes that require medical evaluation should be suspected. Step 3. Review secondary symptoms. Itching related to serious illnesses rarely occurs alone. Observe if you have unintentionally lost 3 to 5 kilograms in recent weeks, feel excessive fatigue, recurrent fevers, or night sweats. These signs, combined with itching, form a combination that deserves immediate attention. Step 4. Analyze the itching pattern. Ask yourself what time of day it is most intense. Itching of internal origin usually worsens at night when the body rests and circulation changes. Also, note if it is always the same spot that itches. When the symptom is constant and localized, it is not typical of allergies or common irritations, which tend to move around. Step 5. Review family history. If parents, siblings, or children have had cancer, your risk may be 2 or 3 times higher. And if the itching appears in one of the previously mentioned areas, prudence dictates seeing a doctor as soon as possible. Genetics play an important role and should not be overlooked. Remember, these 5 steps are not meant to create fear, but to give you practical tools to distinguish the trivial from the important. Your body always speaks. You just need to learn to listen carefully. We have gone through 6 areas of the body where itching can be a warning signal that should not be ignored. Let's briefly review them. Lower legs. Nocturnal itching may be related to lymphomas. Middle back may signal pancreatic issues. Scalp, especially behind the ears and neck, linked in some cases to leukemia. Chest, in both women and men, where inflammatory breast cancer can start with simple itching. Anal area, often confused with hemorrhoids or other inflammations, but can indicate early cancer. Palms and soles. Persistent itching may be associated with internal toxins from tumors. We also reviewed 5 very simple self-assessment steps you can do at home. 3-week test. If the itch lasts longer, it is not common. Lotion test. If no improvement after a week, suspect an internal cause. Review secondary symptoms, such as weight loss, fatigue, or fever. Analyze the itching pattern. If nocturnal and always in the same spot, do not ignore it. Review family history. If your parents or siblings had cancer, risk is higher, and you must be more cautious. I want to emphasize something very important. Not all itching means cancer, but many cancers start with small signals that are easy to overlook. The key is observation and not underestimating what you feel. Record when the itching begins, how it changes over time, and what other symptoms accompany it. Most importantly, consult a doctor promptly if it does not improve. If you found this message helpful, I encourage you to share it with your loved ones, subscribe, and show your support so more people can access this life-saving information. Your health is more valuable than any wealth or recognition. Listen to your body, act today, and build a tomorrow with the peace of mind that you have taken care of what matters most, your life.